Line. The father is in need of a liver transplant, and his wife is making a plea to the community on social media to join the Living Donor Registry.
Fox 61's Alicia Machado joins us in studio after speaking with the family, and she has more on their important search. Alicia.
That's right. Portland mother Stephanie Donahue wants to get the word out to as many people as possible to save her husband, who was officially listed on the National Organ Transplant list a few weeks ago. She's hoping to find someone in the community who might be a match before he runs out of options. Portland father of four, Ryan Donahue, has been battling primary sclerosing cholangitis, known as PSC, for about 15 years, a disease of the bile ducts that can eventually lead to liver failure.
There's no cure for what I have. To kind of exert myself like a normal person would tires me out, running around like kids.
Now the search is on for a living liver donor before it's too late. His wife, Stephanie, making a plea to the community on Facebook, hoping someone might join the donor list and be a good fit for her husband and best friend of 16 years.
The thought of Ryan not being here, especially with 4 kids, it's really terrifying. The thought of our kids not having a dad for big events like graduations and weddings and their own babies someday.
Stephanie says it's important that Ryan find a living donor as soon as possible. He's at a place where a living donor transplant is a viable option. However, he only has a small window of time before he'll be too sick for a living donor.
Having a transplant would allow me to basically probably feel that I'm the best that I've felt in about 20 years, give me life back.
Ryan is not alone. More than 118,000 men, women, and children need life-saving organ transplants, according to Donate Life Connecticut. Liver transplants are done in 2 ways. According to Hartford Hospital's chief of transplant surgery, only 5% are done with live donors, where a piece of the liver is transferred to the recipient.
Luckily, the liver has the ability to regenerate, and so in the donor, within 6 to 8 weeks, the organ will regenerate itself to nearly a full size.
95% are done with a deceased donor, where the whole organ is transplanted into the patient. But here's where it gets tricky with waiting for a deceased donor. Livers aren't typically allocated based on how long you've waited. It's based on how sick you are. The Donahue family is hoping to avoid getting to that point.
Even if it doesn't benefit us, there are so many other people that it could benefit.
For transplants, typically you need to be a compatible blood type with the recipient. If you'd like to learn more about organ donation or join the donor list, we have links up on our website, fox61.com. Just look for today's article.
Alicia, I know that there have been some people who responded to their initial Facebook post, but also tonight you were just saying that there's someone who's already responded who's interested in helping out possibly.
That's right. Our story just aired at 10 p.m. and within the last hour we've already had a woman reach out to us who wants to help and wants to see if she might be a match.
It's amazing.